Ever found yourself wondering what causes alopecia? Alopecia, a term you might have heard before, is a medical condition characterized by hair loss in some or all areas of the body. It's a topic that has gained significant attention in recent years due to its impact on people's lives, affecting not just their appearance, but also their self-esteem and emotional well-being. Now, what if I told you that the causes of alopecia are as diverse as the people it affects? It's not a one-size-fits-all situation. The factors that lead to this condition can range from genetics to environmental influences and even lifestyle choices. In this video, we're going to delve into the labyrinth of alopecia, aiming to unravel its intricate causes and how they contribute to hair loss. So, are you ready to embark on this journey of knowledge? The mystery of what causes alopecia, is it just genetics or is there more to it? Stick around to find out. Did you know that alopecia affects Black people differently? It's a fact that's often overlooked, but it's crucial to understand the unique challenges faced by different groups when dealing with this condition. Black people are disproportionately affected by certain types of alopecia, particularly traction alopecia and central centrifugal cicatricial alopecia. Traction alopecia is often caused by hair care practices common in Black communities, such as tight braids and weaves, that put excessive tension on the hair follicles. On the other hand, central centrifugal cicatricial alopecia, a form of scarring alopecia, is also more prevalent in Black populations and can be linked to the use of chemical relaxers. It's important to note that early detection and appropriate treatment can help manage these conditions and prevent further hair loss. Understanding the unique challenges faced by Black people in dealing with alopecia is an important part of the conversation. So, as we delve deeper into the causes of alopecia, keep in mind that the impact and causes of this condition can vary greatly, depending on one's ethnic background and lifestyle. First things first, what exactly is alopecia? Alopecia, in the simplest terms, is hair loss. However, it's not your typical hair shedding that we all experience. It's a medical condition that can present in various forms and severity. One common type is alopecia areata. This happens when your immune system mistakenly targets hair follicles, leading to patchy hair loss. Then we have androgenetic alopecia, also known as male or female pattern baldness. This type is influenced by hormones and genetic predisposition. There's also alopecia totalis, which results in the complete loss of hair on the scalp, and alopecia universalis, where hair loss extends to the entire body. Then there's scarring alopecia, which is hair loss accompanied by scarring. Each type of alopecia can have a different impact on a person's life, affecting not only their appearance, but also their self-esteem and mental health. Now that we know what alopecia is, let's delve into what causes this condition. Could your genes be the reason behind your hair loss? That's the question we're going to delve into now. Genetics play a significant role in alopecia, the medical term for hair loss. It's like a lottery you didn't sign up for, where the tickets are your genes, and the prize, well, is a predisposition to alopecia. Let's dive a bit deeper. Our genetic makeup, the unique blueprint that makes us who we are, is a complex interplay of thousands of genes inherited from our parents. Some of these genes influence hair growth and hair health. When certain genes are present or interact in a specific way, they can lead to hair loss conditions, including alopecia. It's essential to understand that alopecia isn't a one-gene show. It's a polygenic condition, meaning it's influenced by multiple genes. These genes may work together like a team of unruly horses, each contributing a little bit to the overall effect. It's not as simple as saying if you have gene X, you'll lose your hair. Instead, it's more like if you have a particular combination of genes, your risk of developing alopecia increases. One of the most well-studied genes in relation to alopecia is the AR gene, which codes for the androgen receptor protein. Variations in this gene have been connected to androgenetic alopecia, the most common form of hair loss, often referred to as male or female pattern baldness. But remember, genes aren't destiny. Just because you have a genetic predisposition to something doesn't mean it's set in stone. Other factors like your environment, your lifestyle, your overall health can interact with your genes to influence whether you develop alopecia or not. So, it seems our genes could be one of the culprits behind alopecia. But is it the only cause? Not quite. Stay tuned as we explore other factors that could be making your hair bid you an early goodbye. Apart from genetics, what else could be causing your hair to fall out? Well, alopecia isn't always a result of your family tree. There are several non-genetic factors that can also lead to this condition. Let's dive into some of them. First off, Hormonal changes can play a significant role in hair loss. Changes in hormonal balance, especially during pregnancy, menopause, or due to thyroid issues, can disrupt the normal hair growth cycle. This can lead to an increase in hair shedding or a decrease in hair growth, resulting in thinning hair or bald patches. Next up, stress. It's not just bad for your mental health, it can also lead to physical changes, including hair loss. When the body experiences significant stress, whether emotional or physical, it can push more hairs into the resting phase of the hair growth cycle. Once these hairs enter the resting phase, they will eventually fall out, leading to a condition called telogen effluvium. Certain medications can also contribute to alopecia. Drugs used in cancer treatment, high blood pressure, arthritis, and depression, to name a few, can cause hair loss as a side effect. It's important to note that not everyone taking these medications will experience hair loss, and if they do, it's usually temporary. Lastly, let's talk about autoimmune diseases. In conditions like alopecia areata, the immune system mistakenly attacks the hair follicles, leading to hair loss. Other autoimmune diseases such as lupus or lichen planus can also result in alopecia. It's worth mentioning that each of these factors can contribute to hair loss individually or in combination with others. In some cases, it can be difficult to pinpoint the exact cause of alopecia, as it could be due to a mix of genetic and non-genetic factors. So, alopecia can also be caused by factors other than genetics. It's a complex condition with multiple causes. Understanding these causes is the first step in managing alopecia and finding the right treatment approach. Now, how do these causes lead to hair loss? To answer this, let's first understand the process of hair growth. Hair grows from follicles, which are like tiny pockets in our scalp. Each follicle has a life cycle of its own, divided into 3 phases: the growth phase, the transition phase, and the resting phase. In the growth phase, which lasts for 2 to 7 years, the hair grows. The transition phase is a short period of about 10 days, when the hair follicle shrinks. Finally, during the 3 to 5 month resting phase, the hair falls out. After the resting phase, the life cycle restarts with a new growth phase. Now, let's talk about how the causes of alopecia interfere with this process. Genetic causes of alopecia, like androgenetic alopecia, alter the life cycle of hair follicles. They shorten the growth phase and lengthen the resting phase. This means hair falls out faster than it grows, leading to thinning and baldness. Non-genetic factors also play a role. Stress, for instance, can push hair follicles into the resting phase prematurely, causing hair to fall out. Nutritional deficiencies can also lead to hair loss. For example, lack of iron, which is essential for hair growth, can disrupt the hair growth cycle. Certain medical conditions and treatments can also cause hair loss. Conditions like thyroid disease can disrupt the balance of hormones in the body, impacting the growth phase of hair follicles. Treatments like chemotherapy, on the other hand, target rapidly dividing cells, and since hair follicles are among the fastest growing cells in the body, they are often affected, leading to hair loss. Lastly, physical damage to hair from excessive styling or harsh hair products can weaken hair and cause it to break off from the follicle. In conclusion, both genetic and non-genetic causes of alopecia interfere with the life cycle of hair follicles, disrupting the balance between hair growth and hair fall, ultimately leading to hair loss. Now that we understand how these causes lead to hair loss, let's summarize everything. Let's wrap up everything we've learned today. We've embarked on a journey to understand alopecia, a condition that results in hair loss. We started by defining alopecia, a term that might have seemed alien to some of us, but is now a part of our health vocabulary. We learned that alopecia is not just a single condition, but a group of conditions, all leading to hair loss. We then delved into the genetic causes of alopecia. Our genes, those tiny blueprints that make us who we are, can sometimes be the culprits behind hair loss. We learned about how certain genetic predispositions can lead to different forms of alopecia. We discovered that alopecia can be hereditary, passing down from generation to generation. From genetics, we shifted our focus to non-genetic causes. We discussed how alopecia can also be triggered by factors outside our genetic makeup. These include stress, certain medical conditions, and even some medications. We learned that in some cases, our own immune system can mistakenly attack the hair follicles, leading to hair loss. We then connected the dots between these causes and hair loss. We saw how genetic and non-genetic factors can disrupt the normal cycle of hair growth, leading to the thinning of hair and eventually, hair loss. We discussed how these causes can affect both men and women, and how the pattern of hair loss can vary from person to person. And there you have it, The causes of alopecia unraveled. Remember, knowledge is the first step towards dealing with this condition. Stay informed, stay healthy. As we continue our journey in understanding alopecia, let's delve deeper into how this condition affects Black people specifically. Hair is not just about aesthetics, especially in Black communities. It is a symbol of cultural identity, self-expression, and pride. So when alopecia strikes, it's not just a physical loss, but also a psychological one. The emotional distress and lowered self-esteem associated with hair loss can be profound, leading to feelings of embarrassment and even depression. In addition to the psychological impact, there's also societal pressure and stigma to contend with. Hair loss is often seen as less desirable or attractive, and these stereotypes can create a significant amount of stress for individuals dealing with alopecia. This is why understanding and empathy from society as a whole is crucial. Moreover, addressing alopecia can lead to a financial burden. Treatments can be expensive, and the cost of wigs, hair extensions, or other hair care practices can quickly add up. This can create an additional layer of stress for individuals grappling with this condition. In conclusion, understanding the unique impact of alopecia on Black people is crucial in addressing this condition effectively. It's not just about finding a cure, but also about creating a supportive environment that acknowledges the emotional and financial challenges that come with alopecia. Join us in spreading awareness and empathy for those dealing with this condition.